Welcome back. It's Tuesday, and that means a virtual house call from the good doctor, Dr. John Torres.
Yeah, today Dr. John is answering viewer-submitted questions. How are you, Dr. John?
I'm doing great, and these questions are great. I love these questions. And this first question actually comes from Elaine, and she writes, I'm taking blood pressure medication and cholesterol medication. Can I take turmeric with this? That's a spice. And the answer is yes, more than likely you can, but turmeric does interfere with some medications, so you want to be careful. And particularly, depending if you're taking blood thinning medication, stomach medication, or diabetes medications, those are the ones you worry about. When it comes to the stomach medication, we're talking Nexium, Pepcid, Zantac, those types of medications. It actually makes them work a little bit less, so you could produce more stomach acid than you normally do on these medications, and that could cause problems. When it comes to the blood thinning medications, we're talking Coumadin, aspirin, Plavix, those types of medications. It can actually make them stronger, which makes you more likely to bleed. And the same goes with diabetes medication. If you're taking diabetes medication, it can make that stronger as well, make your blood sugars drop. Again, you want to be very careful, but for the cholesterol and the blood pressure medications, shouldn't really be an issue.
How do you find the right pill to take? Because there's so many options.
Right, and it's just one of those things. You want to talk to your doctor. You want to make sure, and I tell patients all the time, especially when it comes to herbs or vitamins, include those in your medication list, because we want to know everything you're taking, because some of these things interfere with other things like we're talking about here, just to be on the safe side.
Now, is this turmeric that someone is taking like in a pill form or in cooking?
You know, the viewer just asked about the spice itself, so I think it's just using it for spice and you know, potentially in a pill form too. Right, and so, you know, the other thing here too is essentially this is Colorectal Cancer Awareness Month, so we're keeping a lot of awareness about colorectal cancer, and one of the things they're doing here is the Gastroenterology Associates of Colorado Springs is having their first annual free colonoscopy day for uninsured and low-income patients. It's this Saturday from 8 to 3. Again, March is Colorectal Cancer Awareness Month, so to bring attention to this important screening, in addition to the free colonoscopies, they're also going to have food and drinks available to those not undergoing a colonoscopy, because they're trying to get you to go there to stop by, find out more information about the important test. They're also going to have personnel on hand during the day to answer questions and even schedule a colonoscopy later on. It's at Pikes Peak Endoscopy Center. We're talking Fillmore and Union, 1699 Medical Center. You can go to gacsonline.com, get more information. And again, it's a very important month. It's a very important awareness because it's one of those hidden diseases. A lot of times people don't find out till it's too late.
All right. Thanks so much, Dr. John. And you can get your own medical question answered if you submit it on KRDO.com. Just look for Dr. John at the top of the home page.
And you can also submit your video question to KRDO News at KRDO.com.